parents may feel protective and limit their child's activities due to fear of recurring seizures, which can impact the child's development and independence.
Fellow Homo sapiens, my name is Tori Robinson and welcome back to Epilepsy Sparks Insights. The epilepsies affect people from all over the world, including people from Iran, where, as we shall learn today from our guest, there are clinicians and researchers working both together and internationally to improve access to care, quality of care, and to reduce beliefs like seizures are linked to supernatural causes or moral failings. So, may I introduce to you neurologist and epileptologist from Tehran, Reza Shervin-Badv.
In my role as a pediatric neurologist and epileptologist, I have fortunate to lead and participate in several key initiatives. For example, I have helped develop a specialized epilepsy clinic that provides comprehensive diagnostic and therapeutic services for children with epilepsy. Our amazing team includes pediatric neurologists, neurophysiologists, epilepsy nurses, and social workers, neurosurgeons, and psychiatrists, ensuring a holistic approach to care. We also have a dedicated fellowship program on pediatric neurophysiology in our center, Children's Medical Center, Pediatric Center of Excellence, Tehran University of Medical Sciences. Additionally, I have been involved in training programs for new specialists and conducting research on drug-resistant epilepsies in children, ketogenic diets, genetic epilepsy, focusing on improving treatment outcomes through personalized care plans and precision medicine. We work closely with international collaborators to ensure we are using the most up-to-date protocols. As a part of a team, I emphasize team collaboration and patient-centered care, recognizing that managing pediatric epilepsy requires ongoing communication between medical staffs, patients, and their families. Epilepsy care in Iran has come a long way, but there is still much to be done, especially in expanding access to remote areas, because Iran is a big country. I am proud to be a part of a dynamic team that is helping to drive these changes and improves the lives of children with epilepsy through both clinical work and also advocacy.
Do tell us about epilepsy care in Iran. It's somewhere that I haven't yet visited.
Iran has seen significant advancements in recent years, with increasing collaboration between neurologists, both pediatrics and adults, epileptologists, pediatric and adults, and other healthcare professionals. Many leading academic centers and hospitals in major cities like Tehran, Isfahan, Shiraz, Mashhad, and Ahvaz now offer specialized care for epilepsy, including access to state-of-the-art diagnostic tools such as video EEG monitoring, dedicating MRI, and other neuroimagings, and also genetic tests and techniques. Epilepsy surgery programs are also becoming more common, especially for patients with drug-resistant epilepsies. This multidisciplinary approach includes neurologists, neurosurgeons, psychologists, and social workers, ensuring that patients receive comprehensive care. However, in some remote areas, access remains more limited, and efforts are ongoing to improve this.
So what about epilepsy research? How are things on the academic side in Iran?
Academically, Iranian universities and research centers are involved in cutting-edge research on epilepsy, and institutions and some organizations like Iran Epilepsy Society and Tehran University of Medical Sciences, Shahid Beheshti, Shiraz University, And Isfahan and Mashhad universities conducting studies on genetic causes, treatment outcomes, and the psychological effects of epilepsy on children and their families. On the other hand, collaborative efforts with international epilepsy organizations allow Iranian researchers and clinicians to stay updated on global advancements. This collaboration include cooperation with ILA and other international organizations.
Fabulous.
Additionally, specialized epilepsy conferences are held regularly to foster knowledge exchange, and academic programs are being developed to train more adult and pediatric neurologists and epileptologists to meet growing demands. From supportive point of view, Iran also benefits from supportive associations dedicated to epilepsy awareness and patients advocacy. The Iranian Epilepsy Association plays a significant role in educating the public and offering resources to families dealing with epilepsy. They host awareness campaigns, workshops, and offer counseling services to families to help them navigate the challenges of the condition.
There's a global stigma as far as epilepsy is concerned, but I'm aware that in certain countries this can be more noticeable. How are things in Iran?
In many parts of the world, especially epilepsy is often misunderstood, which can lead to a stigma. Historically, cultural beliefs have linked seizure to supernatural causes or moral failings, although these perceptions have improved over time with increased awareness of communities. However, some families may still experience social stigma that affects their willingness to seek medical help or disclose the condition, especially in more traditional or rural areas. Children with epilepsy may face challenges in school where teachers or peers not fully understand the condition. This led to social isolation, bullying, or underestimating the child's potential and abilities. Parents may feel protective and limit their child's activities due to fear of recurring seizures, which can impact the child's development and independence. That said, with the growing efforts in public education and advancements in medical care, families are increasingly accessing a specialized treatment and support and also knowledge. As healthcare providers, our role involves not only offering medical treatment and management of epilepsy, but also addressing these cultural perceptions by educating families and communities to reduce stigma and improve the quality of life for children with epilepsy.
So how are things moving forward with improvements in quality of care in Iran?
Today, growing public education efforts by healthcare organizations, supportive associations, and media have helped demystify the condition. On the medical side, advancement in diagnostic technologies such as video EEG monitoring, epilepsy centers, and neuroimaging, along with the growth of specialized epilepsy clinics and centers, have improved the quality of care. There is also a shift toward a more multidisciplinary approach involving neurologists, pediatric neurologists, adult neurologists, psychologists, psychiatrists, neurosurgeons, and social workers, nurses, and other parts of the team, which ensures more comprehensive support for children with epilepsy and their families. while challenging remain, we are moving forward a more informed and supportive environment.
A huge thank you to Reza for sharing information about his SLIC team, his value of international connections and collaborations, and how he is helping grind away at cultural misconceptions about the epilepsies to improve people's quality of life in Iran. Do check out Reza's papers and more about his work on the website toryrobinson.com, where you can also access the podcast, the video, and the transcription of this entire episode. And if you haven't already, please don't forget to like, comment, and subscribe to this channel, and share this episode with your friends, colleagues, family members, whoever it might be. See you next week.